So I'm here with Sally and Rachel today, who are two of our research nurses that work in the Yorkshire Quality and Safety Research Group based here in Bradford. Hi.
Hi.
Hi. So there are over 5,000 research nurses working across England today, who at one point were all nurses themselves and have moved across into research. And most of them work in clinical research on things like drugs trials, but you actually work in applied health research. So can you tell us what attracted you to that as opposed to drugs trials?
What attracted me was that I wanted to step back a little bit from frontline work, and before I had a job as a matron, I'd done a lot of work in training and development, clinical governance, quality and safety actually. And it was stuff that I really enjoyed and felt could make a difference to patients and their experience in hospital. And because of that, when I saw an advert for a quality and safety research nurse, it was all the things that I had really got a lot of enjoyment out of while I was working clinically in an acute NHS trust. So I applied and I haven't looked back since.
Excellent.
And what made me apply was I have done quite a bit of clinical trials, and it was a different aspect to research. To me, it seemed more flexible. You're more involved in the actual starting up and getting it like an acorn growing from the ground to getting that tree, and then branching out and trying to find out actually have we made something that actually is going to work for different areas and can be generalised.
The thing that I like about it is that we are taking evidence from the universities, from all over the place, and using it to solve real problems that happen in hospitals, on wards, in healthcare. The problems that we look at can come from complaints, they can come from incidents, they can come from chatting to somebody who has something that they need to solve on the ward, or equally from talking to patients about their experiences. And we then take the evidence that is out there and work out how to make it work to make life better and safer for patients, be they in primary care or secondary care.
Excellent. So as research nurses working in applied health research, what are the sorts of things that you do?
It's quite varied really. People may think that our main role is recruitment, which we do. We go out and see a lot of people, but it's actually at the setting up the process as well. We help train people so they know a little bit about research, but also what the study involves. We have interventions which we need to be able to explain to people. We have meetings to discuss how we're going to take things forward. And in this sort of research, I find that we're not scared to sort of like stand up and say, I don't think that works. Where I think in clinical research, things are already quite set in a tablet of stone and we have to go for it. It is a little bit more flexible. It's nice to be able to sort of like have a role in sort of like changing what's happening.
Yeah, I think that it's we're very much part of a team here. We're part of a multidisciplinary team that involves psychologists, social scientists, healthcare professionals, and we all work together. And we do generally get involved from the beginning of a project, from on occasions putting in bids for money, and then looking at the evidence and working all the way through to an intervention that can be tested across multiple hospital sites. We do recruit patients, and that is a big part of our job when we've got a big trial that's going on. But we also help with writing, publications. We're very much part of the team. I've had to become more open-minded since I started working in this team, because we have the knowledge of healthcare and how it works, and that's what we bring to this environment and the teams. But I've had to become more open-minded about what can and can't work within healthcare, because someone will come up with an idea or something they want to look into, and I'll say, you'll never change that. Are you joking? But actually, once it starts being tested and being moved forward, I've been absolutely amazed by how much uptake there has been for things at the beginning that I've thought, oh no, we can't do that. But that's how we're moving things forward, and how change is happening within healthcare and research.
So one of the things we talked about before was the fact that you needed to learn a new language working with academics.
Yeah.
Has that been daunting?
It has a little bit, yes, but it's not something to put you off, and everybody learns something every day, they reckon, so it's probably a good thing, and people are open-minded. You can actually say, what does that mean, and not feel silly about it, because actually there might be other people in that room that actually don't know what that is as well. So
it is quite interesting to begin with when you realise that you haven't understood I don't know how many words of a conversation, but equally the language we use as healthcare professionals is also quite daunting for the academics that we work with. So it works both ways, and we work in a supportive team, and people understand that we don't all understand everything. And
I think it's the same sort of like we can cross-transfer it to the hospital environment though. There's a lot of acronyms used in medical terms, so they have their acronyms and we have ours, and it's sort of like understanding both sides of the coin, because they might not understand ours but we don't understand theirs. So I think that's a generalised thing. It's just a learning curve to do it.
So as research nurses working in applied health research, what skills do you need, and what training have you had for those?
We were talking about this another time, weren't we? And we were saying the skills are quite cross-transferable. We said that we thought that communication was a big one. Being able to cross-transfer that is really important. Timing of things, background knowledge, understanding what you're doing and why you're doing it. Things like that, aren't it?
You need to be quite organised.
We said about times of things, didn't we? And to be a good time management in one sense, but be flexible as well, because things always change, sort of like in research, but that could be said the same in a hospital environment. You have to sort of like adapt to that environment, and I think nursing staff are very adaptable, and it's just a different sort of adaptability.
Definitely, they are transferable skills. From a knowledge point of view, I had done modules on research in my degree and in a master's degree, and those modules were perhaps more applicable to the sort of applied research that we do here than they would be to clinical research, because the applied research is more like the research you would do as a nurse as part of further education, but there is lots of development around to support you to gain the skills. When I first arrived, I went on a one-day-a-week course for 3 months about an introduction to research at one of the other hospitals locally, and that was very helpful, and that just served as a recap for the stuff I'd done previously.
I think sort of like overall, the one thing that both sides have got is the best interest of the patient.
Absolutely.
And that's sort of like, you know, if people are in a job where you care and you want the best for people, that's what both sides of the coin want. Research want that, and the patients and the hospital staff.
Okay. Well, thank you very much today, and that's it.